said, we don't have time to wait to urge people and motivate people. We're asking for an order from the governor.
That was Greg Bell, president and CEO of the Utah Hospital Association, back on July 8th. At the time, the association submitted a letter to the governor asking for a mask mandate. And joining us again tonight is Greg Bell, president and CEO of the Utah Hospital Association. Greg, thank you for being with us here tonight.
Delighted to be here.
Greg, you actually have background and experience politically here in Utah. You were Utah's former lieutenant governor, and you served 2 terms in the Utah State Senate. Do you think that our state leaders have taken the right steps in responding to the pandemic thus far?
I think we've done a really good job. You know, the hospitals wish that we had a statewide mandate on masks in the latter part of June and July when we had that spike. Indeed, people responded. There was a mandatory mandate in Salt Lake and Summit counties, but people responded voluntarily in a lot of parts of the state. And that mask and social distancing regime has really made the big difference. And we got control of the thing in August, but of course now we've lost it again with this spike.
Now, we're seeing a rapid growth in COVID-19 cases again after a decline in the summer. So now we're approaching influenza season as well as school being in session. Are there any concerns with hospitals potentially reaching capacity and running out of bed space?
We're very concerned, Rosie. A couple of things, as you pointed out. Of course, the holidays always make things spike. You know, Memorial Day was a terrible time. The 4th of July was right in the middle of that big spike in July. Labor Day apparently has contributed to a rise in cases. We're anticipating flu season, which puts a strain on our ICUs in the best of times. We're hopeful that we have a small flu season this year, because with that, our normal ICU usage and then COVID, it could really strain our resources.
Do you know how full our hospitals are at right now, and at what percentage in capacity do the warning bells start going off for hospitals?
Our general hospital beds are about 50%. We've got capacity there. Our ICUs in the larger hospitals, the centers where people go to with difficult cases, are running about 80% in the ICUs. So we don't have a lot of room to wiggle even in the best of times. At the peak in July, our ICU capacity was strained. On the COVID side, we had about 23% of ICU beds occupied, and we got down in the first part of September to about 10 or 11%. So we've declined greatly, but if this spike results in hospitalizations, as it surely must, then again, it's going to push us.
Going off of that question, what do you know about what hospitals are potentially doing to prepare for overflow or a need past the bed capacity that they have now?
Well, back in the spring, when we had the Milan and the New York situations and everyone was panicking, and then since then, of course, we've got Chicago, New Orleans, or Arizona notably, Seattle. We had to think, what could we do? And part of it is room and beds and ICU beds, which have very technical wiring and support systems. So we've expanded those. We also have expanded the staff to the degree we can, and even to the point of making arrangements for foreign, not foreign, but out-of-state nurses and techs to be able to come in and respond if we have that overflow need.
I want to talk about the people who work right at our hospitals. For a lot of members of the public, this pandemic is out of sight, right, out of mind. But our healthcare workers, those working on the front lines, they really have to make a sacrifice when the need increases. So can you help illustrate why it's so easy for our healthcare workers to get burned out, the toll? What is it like for these people who are in the scrubs, in the hospital rooms, every single day fighting this pandemic?
Well, God bless these frontline healthcare heroes, because what they deal with in these life and death situations often with a death, without the family able to be present. I mean, you just can hardly imagine what they must be going through to deal with the medical as well as the psychological effects of someone fighting for life and losing their lives. As with other disasters like an earthquake or a hurricane, you have a rush on the hospitals, people see the event, and there's an outpouring of concern. Here it's just one by one. That's not publicized. Someone falls ill, they go to the hospital, they move into the ICU, they're put on a ventilator, perhaps they pass away, perhaps they're released. But they may have a months-long struggle with respiration or neurological functions, but it's all done behind the scenes, one at a time. So how could we have lost 200,000 people in America and anyone, hardly anyone notices other than when there's a direct picture like morgue trucks in New York?
Right. Greg Bell, President and CEO of the Utah Hospital Association, thank you for taking the time to join us here on the show tonight. We appreciate your insight.
Thank you.